A major national study ranks New Jersey 32nd in the most common chronic diseases. The report by the California-based Milken Institute says it's costing the state $39 billion a year. Obesity is the major underlying factor. NJN News health and medical correspondent Sarah Lee Kessler reports.
The report is called An Unhealthy America, the Economic Burden of Chronic Disease. Its author, economist Ross Duvall, looked at 7 of the most common chronic diseases and found that New Jersey has more than its share.
In total, there's 4.6 million cases of these 7 chronic diseases in New Jersey.
They include various cancers, diabetes, heart disease, hypertension, stroke, mental disorders, and pulmonary conditions. The study says the economic impact here in New Jersey is $39 billion a year in lost productivity as well as direct treatment costs. The skyrocketing obesity rate in adults and children is a major factor.
Smoking rates back in the late 50s, early 60s were public enemy number 1. Today, rising rates of obesity is truly public enemy number 1.
Healthcare experts who attended this New Brunswick news conference earlier this week agree.
Number 1 killer is heart disease, and number 1 risk factor for that is diabetes. And the major risk factor for diabetes is weight issues, obesity.
The study is being seen as a call to action because chronic disease is a major driver of healthcare costs.
The important thing to remember is that it's actionable. This isn't bad news. This is an opportunity.
It's an opportunity to change our behavior, both as a society and as individuals.
We basically spend 10 cents out of every dollar in the healthcare system on prevention. And we need to focus much more on prevention and early interventions.
There are a lot of people out in New Jersey who want to believe there's a pill to treat everything, that it doesn't matter what kind of lifestyle they lead. That's simply not true.
We can't do health reform without attacking this problem. It's naive. This is as critical an element to health reform is making sure we've got the uninsured, insured, and so forth.
The experts here agree that good health needs to be viewed as an investment in our future. Sarah Lee Kessler, NJN News, New Brunswick.